Good evening to all panel members. Today I'm going to present my title on drug utilization on non-selective, non-steroidal anti-inflammatory drugs in outpatient department of a private hospital. It's a retrospective study. And my name is Shashi. Today I'll be presenting this topic. Now, when you look at non-steroidal anti-inflammatory drugs, right, it's commonly prescribed as painkillers, okay? And basically, it's prescribed to treat acute and chronic pain. Basically, it's associated with inflammation, okay? The general objective of this study is basically to describe the drug utilization pattern of non-selective NSAID in KPJ Seremban. So basically what we are planning to do is we are basically collecting the demographic data, and we also comparing the defined daily dose of non-selective NSAID together with the WHO defined daily dose. And also we are analyzing about the prescribing pattern in KPJ Seremban. Besides that, we're also doing a cost analysis on non-selective NSAID prescribed in the past 3 months. Now let's look at the study design. Basically, we are collecting all the non-selective NSAID prescription. Basically, we are targeting the patients more than 18 years old, and also patient prescribed with any tablets or capsule of non-selective NSAID, regardless of dosage form, and also all prescription from January 2019 up to March 2019. Okay, now looking into the sampling procedure, how we have done this research, basically we have gone through all the prescription prescribed by the doctor, okay, and we screen through all the data, and we filter the non-selective NSAID, and we record them in our pre-formulated record tool. And basically we have done a small analysis, which is like descriptive analysis. So looking into our results, right, basically when we look into the demographic factor, mainly most of the NSAID prescribed was like less than 45 years old. But one of the things here is most of the NSAID were prescribed to Malays. And when you look at male or female, female is slightly higher. And also when we look into the medical officer or specialist prescribing the NSAID, specialists prescribe higher amount of NSAID compared to medical officer. Other than that, when we look at cost, cardiprine has the highest cost because the most amount of NSAID prescribed was cardiprine. And also the next thing here, when we look at the duration of prescribed, okay, most of these NSAID were non-selective NSAID were prescribed more than 10 days. And besides that, we can see that, okay, looking into the WHO DDD calculation, aspirin has the highest prescribing rate, okay? Now, let's look at the discussion here, okay? So basically, the female who found higher using analgesic, basically it's susceptible to their other pains, like they're having menstrual pain, all these pains, they are selecting these non-selective NSAID because the NSAID will cause the gastric problem. Now, besides that, we can see more group of people using 19 to 44 because of lack of outdoor activities, most of them are suffering from cardiovascular risk, okay? And besides that, the size of most of the patients were observed to be obese, okay? Now, when we look at pattern, utilization pattern, many of them preferred using diclofenac over naproxen, okay, but the aspirin was the highest. But when we look at the other disciplines also like cardiovascular and also like other preventive measurement, also they are using aspirin. Now, besides that, when we look at daily defined dose, okay, the high average maintenance dose was found in aspirin as well as diclofenac because diclofenac may be due to higher rate of pain in pain scoring. So in conclusion, okay, we can see that the most used drug is cardiprine, and the daily cost of this drug using, we can see in other drugs like diclofenac will use very less compared to cardiprine itself, which is a combination of aspirin. Thanks a lot and have a nice day.